inflammation of the lining of the surrounding of heart, the pericardial sac. Pericardial effusion is the collection of fluid in the pericardial sac. This fluid may be produced by inflammation. The causes of pericarditis in most individuals is unknown but is likely due to viral infection. Pericarditis may be an associated complication of many diseases or may be due to trauma. The diagnosis of pericarditis is made by history and physical examination. Testing usually includes electrocardiogram, chest X-ray or echocardiogram or ultrasound of the heart. The inflammation of pericarditis is usually treated with anti-inflammatory medications such as ibuprofen. It is important to treat the underlying disease or illness if one is present. Pericardial tamponade occurs when enough fluid accumulates in the sac to compromise the heart's ability to adequately pump blood. Tamponade is a medical emergency and is treated by pericardiocentesis, inserting a needle into the pericardial sac to remove the fluid. What is pericarditis? The heart muscle has a tight covering that surrounds it, a lining sac called the pericardium. This sac actually has two layers. The visceral pericardium is only one cell layer thick and fits tightly onto the heart muscle. The parietal pericardium is much tougher and tighter and thicker and has fibers that tether the heart to the ribcage and diaphragm. There is a potential space between the layers, meaning that in normal situations it has minimal amount of fluid. However, should inflammation occur, it can fill with fluid. Inflammation of the lining of heart is called pericarditis. Symptoms of pericarditis are: chest pain is the most common symptom. Classically, the pain begins in the center of the chest and radiates to the neck and upper back. The pain is sharp, stabbing, but may also be felt as a dull ache or burning pain. The intensity may be mild or sudden. The pain makes it hurt to take a breath. Most individuals feel worse when lying flat. Other symptoms may include fevers and chills, sweats, shortness of breath, and difficulty swallowing. When pericarditis is due to infection, the symptoms tend to arise quickly. Inflammation due to chronic diseases is more gradual in onset. Pericarditis is usually from unknown causes. The cause may often be viral infections. Causes of pericarditis include infections, viruses, bacteria like tuberculosis, HIV. Inflammatory diseases, diseases that can cause generalized inflammation in other places within the body can also cause inflammation of the pericardium. Some examples include rheumatoid arthritis, systemic lupus erythematosus, scleroderma, ankylosing spondylitis, inflammatory bowel disease, metabolic illnesses, kidney failure and uremia, hypothyroidism. Heart disease. Heart attack can cause direct irritation and inflammation of the pericardial lining. Dressler's syndrome describes inflammation caused by an immune response to the heart tissue, damage from heart attack, open heart surgery or a trauma. Other causes: tumors, radiation therapy, medications. How is pericarditis diagnosed? History and physical examination. The diagnosis of pericarditis begins with a healthcare professional taking a history about the pain and its character. The healthcare professional will perform a physical examination and ask the patient about associated symptoms. Past medical history is important since pericarditis can be a complication of a chronic disease or a side effect of medication. The most common physical finding that helps confirm the diagnosis of pericarditis is pericardial friction rub. Inflammation prevents the two layers of pericardium from easily sliding against each other with each heartbeat. The inflammation causes a friction noise that can be heard with a stethoscope. When listening to the heart, it is better heard when the patient leans forward, which causes the heart to shift to the front of the chest. The rub may not usually be present and may come and go from heart to heart. We'll continue with pericarditis in the next video. Thank you.